Friends, today we're going to talk about venereal diseases, but the correct term is sexually transmitted diseases. I'll tell you how to check for them yourself and how to treat them. We'll look at the main types of diseases, the main ways to treat them, and the consequences if they're left untreated. What are the main signs that may indicate you have a sexually transmitted infection? So be sure to watch this episode until the end and you'll be armed with the knowledge you need to fight this problem. Friends, you sometimes underestimate venereal diseases by associating them with something else. If these patients had received the correct diagnosis and timely treatment back then, they wouldn't have had to undergo 3, 4, 5, or even 6 surgeries today, or be left with a tube in their abdomen. This is called a cystostomy. So let's talk about venereal diseases from a scientific point of view, but in simple terms. Let's start with the fact that actually it was quite interesting news for me as well that there are 120. The first article of the Criminal Code of the Russian Federation punishes those who infect you with venereal diseases or have sexual intercourse with you, knowingly being ill but not warning you about it. You can go to prison for many years. You can spend half a year paying your entire salary to the victim of your actions, and that's not even mentioning the social consequences. For example, if it's about infidelity, it can lead to the breakup of a family or your sexual partner leaving you. The most well-known sexually transmitted infection or disease is syphilis. Why syphilis? Actually, that was the name of a shepherd. His name was Syphilis. And according to legend, in the year 1500, he had sexual intercourse with Vanya. And so, having contracted the disease in this way, this venereal disease was named syphilis. Mentions of syphilis date back to even earlier times. And based on the clinical manifestations, we can conclude that this disease really did exist. And from the exhumed remains, we see signs of many diseases that were diagnosed even before we learned about syphilis. Let's start with the basics. What will benefit you and help you get rid of, first of all, the fear of diagnosis? Because why are you all afraid of getting tested for sexually transmitted diseases? Even when you've had unprotected sex and it seems like there might be something but there are no symptoms, are you still afraid to go to the doctor? Why? Because most often you're afraid that they're going to hurt you, that they're going to stick that big sharp brush into your urethra and it's going to hurt when you pee afterwards. After that, it lasts for a long time. In reality, this can be avoided and it's actually very simple to do. A sterile container from the pharmacy, the first portion of urine goes into this sterile container and you just take it to any laboratory and ask them to perform a polymerase chain reaction test on the urine. There's no need to use a swab in the urethra to diagnose most sexually transmitted infections. If we're talking about diagnosing viral hepatitis or diagnosing the herpes virus or human immunodeficiency virus infection, then that's a blood test. The most important thing to understand here is that there is an incubation period, and even if you're absolutely sure you received a sufficient dose of the virus to get infected, you won't see it in your blood. And that's why there's really no point in rushing to get tested right away. The incubation period is 2 to 3 months. After unprotected sexual contact, you are at risk that something else might show up. There's also the human papillomavirus, which you need to know about so you don't infect your partner because it can't be cured. Sometimes, though, it goes away on its own, it eliminates itself. That's why it's critically important to know if you have it, because not knowing is dangerous. It can spread and lead to serious problems. For example, human papillomavirus. It can cause the person you infected to develop cancer, such as penile cancer or cervical cancer, 10 to 15 years later. Cervical cancer is mainly caused by human papillomavirus, which has no cure. Not everyone is lucky enough for the virus to clear up in 6 to 24 months, and not everyone is vaccinated against it. Let's probably start with the most dangerous viral infection. That's human immunodeficiency virus, the human immunodeficiency virus. It's what leads to what we call acquired immunodeficiency syndrome, which is acquired immunodeficiency syndrome. Back in the 90s, as I remember, there were a lot of huge ads on television, really scary ones about human immunodeficiency virus, about acquired immunodeficiency syndrome, about using protection. Now, that's not the case. Now, there isn't enough awareness in this area. And we all get the impression that maybe this problem has gone away, that maybe this problem isn't about our country anymore, but that's not true. In our country, the Kemerovo region leads in records with an acquired immunodeficiency syndrome risk 42 times higher than all European countries. Can you imagine? In 2022, Russia accounted for almost 4% of the 1.5 million new human immunodeficiency virus cases in 2021. So who beat us in these numbers? South Africa has 14%, Mozambique 6.5%, and Nigeria 4.9%, and India has 4.2%. Why do people in our country get human immunodeficiency virus infections so often? Because we don't use contraceptives enough. We have a rather careless attitude toward our sex lives, and we often change sexual partners. We have a fairly high percentage of drug addicts who get this type of virus through needles, and a drug addict's needle is one of the most common ways. Of course, right now, the human immunodeficiency virus still can't be cured. But if the diagnosis is made in time and therapy is started, people with this virus can live quite a long life. They can have healthy children. Now, some dating sites let you check a box to show you have human immunodeficiency virus and find partners with the same status. There are even, by the way, many couples where one partner doesn't have human immunodeficiency virus and they know about each other's status. The second partner, who is human immunodeficiency virus positive, is on therapy and they have children, they raise them, they live in marriage, even though one of them has human immunodeficiency virus and the other does not. But that doesn't mean you should take this disease lightly. If human immunodeficiency virus is not detected in time, it will lead to a decrease in both the length and quality of your life. It's not human immunodeficiency virus itself that kills, but opportunistic infections like pneumonia. People die from acquired immunodeficiency syndrome, which is acquired immunodeficiency syndrome. The immune system becomes non-existent and a person dies from completely different diseases like pneumonia. Human immunodeficiency virus is also characterized by the appearance of certain cancers that are rare on their own, but when this disease is present, their frequency increases 100-fold. Human immunodeficiency virus is highly contagious, but not as easily transmitted as many believe. That is really, if you had sexual intercourse and your partner has human immunodeficiency virus, the chance that you got infected, if it was classic sex, unprotected sex, is about 1 in 50. We often assume contact always leads to human immunodeficiency virus, but that's not true. The chances of infection are much higher when it comes to anal contact. That is, anal sex, it's several times higher. That's why people with non-traditional sexual orientation often have human immunodeficiency virus infection, meaning it's much easier for them to get infected with human immunodeficiency virus, a drug addict's needle, but not just a drug addict's needle. These are also medical instruments. For example, in a private clinic or dentist office, if instruments aren't properly sterilized, you can get human immunodeficiency virus. Second place is syphilis. The feature of syphilis that you should know about is how primary syphilis manifests itself. At the site where syphilis enters, it is quite contagious. It's not just sexual intercourse. There was an interesting, funny case that I heard from my colleague when a man came in with a lesion on his back. This lesion is called a chancre. It looks like an ulcer, and that's where the infection enters. The peculiarity of a chancre is that although it looks like an ulcer, it is absolutely painless. And the man had this kind of ulcerative defect on his back, and as it turned out, the ulcerative defect was on his back because he had carried a prostitute on his back. Naturally, where there was contact between his back and the vagina, he was left with a mark in the form of a chancre. And the doctor couldn't figure out for a long time what it was on his back. So if you develop a non-healing ulcer after sexual contact, and it's painless, the first thing we should think about and rule out is syphilis. Syphilis progresses through stages: primary, brief, then secondary, and finally tertiary syphilis. That's when people have had the disease for a long time. All those terrifying images, when the nose falls off, the ears fall off, holes appear in the nasal septum and the oropharynx when a person just falls apart while still alive. This refers to the kind of syphilis that hasn't been treated for many, many years and has been allowed to take over our body. If syphilis is detected and treated early, it's easy to cure with just an antibiotic injection, so it's not scary. Catching it early and starting treatment quickly is crucial. It spreads easily, it can be transmitted sexually, and it can also be transmitted quite simply in everyday life. That means you can get infected with syphilis simply by using the same towel. So actually, the stories that say using a public toilet seat is absolutely 100% safe are not true. There are diseases that you really can catch from using a public restroom. Syphilis is also called the great imitator. Why? The great imitator? Because it often presented itself like other diseases. because an ulcer would appear and people didn't realize it was one. People would start treating it as a skin disease and it would go away because the chancre even heals without treatment. But syphilis doesn't go anywhere. This disguise is typical for syphilis, and secondary syphilis already manifests as the appearance of some pustules on the body, a rash. This can happen after a long, huge period of time when the person has already forgotten that they ever had it. Syphilis often goes along with an illness like gonorrhea. In people being treated for gonorrhea, 10% of patients with syphilis also had gonorrhea. They treat gonorrhea, it resolves, and the person feels better. At the same time, sometimes the syphilis would go away, or on the contrary, they would treat the syphilis and the gonorrhea would go away. Secondary syphilis can appear at various times, from 2 weeks to 24 weeks, so the incubation period is quite long. You can get tested for it at any lab, just like for human immunodeficiency virus. Why is syphilis dangerous? These are autoimmune complexes that form and can damage, for example, the aorta, and they can also harm your kidneys. And syphilis isn't just about the sexual organs, it's about your whole body in general. And it can cause a lot of very serious diseases that will be incurable if they are detected too late. What's important to know is that if you've ever had syphilis, unfortunately, every time you go to a hospital, you'll keep getting positive results for syphilis. You'll have antibodies, but there's no immunity to syphilis. So you'll have traces, but you can get infected with syphilis as many times as possible. 80% of fatal syphilis cases are related to cardiovascular damage and the development of neurosyphilis. Syphilis is very dangerous for pregnant women because it really is dangerous and can cause a number of pathological changes in the fetus. The child is born, but there are a lot of dental deformities, deafness, blindness, and a number of other congenital pathological conditions. Gonorrhea is the worst enemy of syphilis, as I mentioned, because its symptoms are more noticeable. People usually seek help for obvious signs like discharge and mention those symptoms. Greenish discharge, spots, burning during urination, that's gonorrhea. People seek treatment and used to seek treatment when syphilis was common for gonorrhea. 1 in 10 people had syphilis, but no symptoms had appeared yet. The therapy they used for gonorrhea also killed the syphilis. The symptoms are very well explained by the meaning of this word. Gonorrhea translates as flowing seed or dripping seed. You constantly have a cloudy greenish fluid containing gonococci is discharged from the urethra. If you see or feel this, don't assume it will go away by itself. Get tested right away and start taking antibiotics immediately. Many famous people suffered from gonorrhea. For example, one of the people who contracted gonorrhea during his campaigns was Bonaparte Napoleon. After this, he banned and strongly opposed prostitution. By the way, he suffered from the effects of gonorrhea for a long time in the future. He had problems with urination. Chlamydia was discovered by Ludwig Hallmann, who was apparently an ophthalmologist. Why an ophthalmologist? Because chlamydia may cause blindness. He found it in people who developed such a serious complication, and the primary cause turned out to be chlamydia. We're all used to it, and there are even some funny songs like Chlamydia with Lydia, and now Lydia has chlamydia. But in reality, it's quite a serious disease that can also cause infertility and other disorders in your body. The key is early detection and diagnosis. So how do you know if you have chlamydia? Chlamydia usually causes a burning feeling when urinating, which indicates urethritis, right? But at the same time, you have discharge much less often, and it doesn't have that specific green color. So if there is discharge, again, just like with gonorrhea, you definitely need to get a polymerase chain reaction test for infection, either with a swab or, as I taught you, through a urine sample. The first part is essential. Can it pass to infants? Yes, during childbirth, and it may make the child sick. Is it always that subtle? If gonorrhea always has symptoms, then with chlamydia, in 50% of cases, men have no symptoms. And we're used to thinking that if everything's okay, there's no need to get checked. If you've had sexual intercourse, no matter how sweetly they talk to you, they say, I'm not sick, nothing's wrong with me. Remember that 40% of people who have a viral or bacterial infection don't know they're sick, and 60% of those who do know hide it. Everything is treated very simply. The key is to identify and confirm its existence. In 95% of cases, you are actually prescribed the same antibiotic. I won't say which one, but it's 1 or 2 antibiotics. So a lot of infections are treated this way. Basically, it's all very simple. It's 7 to 10 days of taking antibiotics, sometimes antifungal medications, for 7 to 10 days for human papillomavirus. The human papillomavirus doesn't seem so dangerous for men, but actually it is, because it causes penile cancer. In women, it causes cervical cancer. 12% of people worldwide have human papillomavirus. There is actually a vaccine for it, and if you haven't had the virus, you can get vaccinated and you won't get sick. The most dangerous are the oncogenic strains of human papillomavirus. There are many types. Some are oncogenic, which means they can lead to cancer, for example, and some are non-oncogenic. Types 16 and 18 are the most dangerous. In the same way, when you get tested, they tell you exactly which type of human papillomavirus you have. You don't need to panic immediately if it's a non-oncogenic strain. Can you relax in this case? Sometimes tests show everything is fine, but you may have been infected with human papillomavirus 5 years ago and it still hasn't cleared. It's just that right now the titer, the concentration of the virus is so low that it can't be detected in tests. Your immunity dropped, the virus grew, human papillomavirus increased, and now the test is positive again. That's why sometimes people test negative, then positive. Is it possible to be cured? Yes, it is. Should human papillomavirus be treated? Most of my colleagues no longer treat it. So either it goes away on its own within 6 months to a year or two, or it doesn't go away and the person becomes a carrier for the rest of their life. Ureaplasma is a pathogen that commonly causes urethritis, leading to burning, discomfort, and tingling during urination. Usually there are no discharges, so if there are no discharges but there is burning, you can suspect ureaplasma. All are treated with antibiotics. Is it dangerous for men? Yes, it can cause infertility. Of course, it's also dangerous for women, especially if a woman is pregnant, because it can cause premature birth. This bacteria often comes back, and many doctors don't really like to treat it because patients keep coming back with it again and again. And it's believed that you can only fully eliminate it from the body when you've normalized your immune system and restored the vaginal microflora. Because normal microflora is the worst enemy for this pathogen herpes. About 67% of the world's population, 3.7 billion people, have herpes. That's a huge number. We've been observing herpes for a very long time, even in clay tablets, and there are descriptions found in excavations that describe the symptoms of herpes. In ancient Egypt, for example, herpes was considered a divine punishment for a crime, and that's why it was also called the divine fire, and people with herpes were expelled from society. The herpes virus was first identified in 1933 by Fleming, and only a few years later, its connection with herpes blisters was discovered. There are two main herpes viruses, herpes simplex virus 1 and herpes simplex virus 2. In one case, it's herpes of the face, usually the lips, which is what we most often see. The second herpes is herpes simplex virus 2, which most often affects the genitals and external sex organs. Herpes simplex virus 1 cannot turn into herpes simplex virus 2. So the herpes that you've always had on your genitals will most likely keep appearing there, and it won't show up on your lips. But herpes can appear in very unusual places. It can even show up on the eyes and can even lead to blindness. Herpes has very specific symptoms. It's the appearance of small blisters that either dry out or can open up, releasing fluid that contains the virus. An important point you should know is that if you have type 2 herpes, your risk of contracting human immunodeficiency virus during contact increases 3 to 4 times. So, if you often get genital herpes and you lead a rather promiscuous sex life without protection, I recommend getting tested for human immunodeficiency virus. Why does it appear when we get cold? Because the body stops holding it back. And that's why the first type of virus, if it's dormant in your body, when you get cold or experience stress. If you get worried, herpes immediately appears on your lip. It's not because it came from somewhere else, but because the body stopped suppressing it and its concentration increased. At this moment, you should remember that the blisters you see contain viruses. So when they open, you can easily become a carrier and infect someone during this active phase. Almost the last infection is trichomoniasis. It very often occurs without symptoms and can often go away on its own. It appears similarly in both women and men. Sometimes discharge is minimal, but with gonorrhea it's usually heavy and abundant. Sometimes it's minor, but still discomfort during urination and burning. And in men, a very common symptom of trichomoniasis is redness of the tip of the urethra. The lips of the urethra start to become bright red. This can be a symptom of trichomoniasis. Treatment of trichomoniasis. Again, all the same broad-spectrum antibiotics that will treat all other sexually transmitted infections will most likely also treat trichomoniasis. The most important thing is to detect it in time and start timely treatment. In general, my dear men, most of my channel's audience is men. That's why I urge you to take care of your health, monitor your hormones, protect yourself, and look after yourself. There's a free masterclass called 7 Secrets of Testosterone, just for you. The link is below this video. It's free, so go ahead, sign up. I'll also present my sports medical support program, Fitness as Science. Looking forward to seeing everyone. Joining will be useful. I think that's it. It's probably hepatitis. What do you need to understand? Now, all of this can be treated. Not so long ago, hepatitis couldn't be treated. Hepatitis is mainly transmitted through needles, through injections, through sexual contact. Hepatitis is more contagious. It can be easily transmitted, and you can get infected even through contact with fluids, even through saliva. But unlike hepatitis C, the treatment is simpler. The most expensive and difficult to treat is hepatitis C. It must be treated, because if you don't treat it, over time, this can lead to the development of a number of pathological conditions, such as liver cirrhosis, which in turn can eventually lead to liver cancer. Hepatitis C is now treatable, but treatment costs vary widely. In Russia, Indian medications cost about 100,000 rubles, while American ones can reach up to 1.5 million rubles. So please take care of your health. Don't rely on the fact that we can cure most diseases, because your body is given to you once and for your whole life. It's not leased, it's not on credit, you won't be able to exchange it for anything else. Take care of your health. The best thing is prevention, not treatment.
Sometimes someone gets tested with a swab and everything is fine. He gets something back, maybe staphylococcus or ureaplasma, and thinks he has everything. They scare him and maybe something else too. They prescribe something in one clinic, but then he goes to another clinic. There they tell him, listen, this is all normal flora, it's all fine, there's nothing to treat.
It's true, sometimes people come in and show their culture results. And you have to remember that not all pathogens are sexually transmitted infections. There is flora that is sometimes normal, and not all flora needs to be treated either. We always start from A, symptoms, and B, concentration. The concentration is always written down. You have something like 10 to the power of something there. It is considered that if the level is less than 10 to the fourth, then treatment is not necessary. We usually carry out treatment when the concentration is higher than 10 to the fourth and there are symptoms present. Some only begin treatment if the concentration exceeds 1 million. Naturally, if you have a strong body and good immunity, many bacterial diseases can go away, and sometimes they are just part of your normal flora. For example, Escherichia coli in a woman's vagina isn't necessarily bad, but it can often cause cystitis because with certain anatomy it can enter the urethra, and you can't do anything about it until you eliminate the primary cause because the rectum is nearby. Contamination happens often, and as long as this anatomical feature is present, there will always be cystitis after intercourse. That's why treatment is pointless unless the primary cause is removed, since its presence isn't a pathological condition. Regarding what contraceptive measures there are, regular but protected sex, being selective in your sex life, avoiding drugs and alcohol. This greatly increases the risk of developing sexually transmitted infections because unprotected sexual contacts occur more frequently. Of course, that's the basics, but there are also various types of contraception. I have an episode on my channel where I discuss contraception in detail, covering its types and their pros and cons. So I definitely recommend that anyone who watched this episode go check it out. Today, let's sum up what to do if you have any symptoms. It's very simple. Almost all the bacterial diseases I mentioned today, not counting viral ones, are treated with pretty much the same medications. So if you got your tests done and you received a whole bunch, 3, 4, or even 5 pathogens, don't worry, the number of medications you'll be treated with most likely won't change. In any case, you'll be given the same broad-spectrum antibiotic that will work against all these pathogens. It's best not to let it get to that point or rely on this, since some diseases can't be cured. For example, human immunodeficiency virus stays with you for life. We haven't learned how to cure or fight it yet. So please don't treat diseases, focus on preventing them. Be selective in your sex life, be faithful to your partners, and use protection. Stay healthy. Dear friends, thank you for watching this episode until the end.